And we're live.
Okay. Hi, everyone. Thank you so much for taking the time to join us today for our Starts With One Facebook Live event. This is really just an opportunity to have a real conversation around why it's important to lock up your medications, how you can store your medications safely in your home, and what you can do to minimize the amount of medications that you have in your home. With us on this call today, I have Jessica Blose, and Jessica is a certified mental health and substance use counselor, as well as the State Opioid Treatment Authority. And she is joined by Endalkachew Abebaw, and Endalkachew is a prevention systems manager with the Healthcare Authority's Division of Behavioral Health and Recovery. He is also earning his master's in social work and his master's of public health simultaneously from the University of Washington. So there are going to be some great conversation from them. My name is Melissa Temke, and I'm the Behavioral Health Communications Manager at the Healthcare Authority, and I will be your monitor today, your moderator, not your monitor, your moderator. So before we start, I just want to start with Jessica. And Jessica, I just want to ask you a really broad question, which is, why is it important to lock up your medications? We talk about it, we make a huge deal about it, but what is the big deal?
Sure. So thanks for having me on today, Melissa, to talk about why it is so important to have safe storage of prescription medications. And this is a really important topic for all families to think about because it's also super easy and super important. But when we say it's really important, what exactly do we mean?
Mm-hmm.
So research shows us that about 75% of all opiate misuse starts with a prescription medication that is being taken that wasn't actually prescribed to that individual. So what this means is that 75% of folks who start misusing opioids are actually taking a medication, firstly, that maybe wasn't prescribed to them, but that is prescribed to both a friend or a family member. I'm just going to do a quick check. I hear an echo. Does everything sound okay on everyone else's end?
Yes, sorry, that was my fault, but I think we're good.
Okay. But yeah, so basically there are really simple and easy steps that everybody can take in order to help protect loved ones in your home. So one of the first things that any family can do is to think about where you're storing your medications now. So you do not necessarily want to keep medications in a place you maybe traditionally would keep medications, like a kitchen cabinet or a bathroom cabinet. You want to make sure your medications are not being held in a high traffic area in your home where everybody already knows where they are and how to get access to them. What you actually would want to do to help keep people in the home safe is actually to think about where you should store your medication and actually storing it in a secured either storage area or location or a secure storage device. So when I'm saying secure storage device, what exactly do we mean by that? We're actually talking about a literal container or a medication locking device where you keep your medications. So there's a variety of different types of devices that you could actually think into purchasing for your family.
Mm-hmm.
One are actually locking medication containers, like a locking medication box, and then also locking medication bags.
Mm.
So when we're talking about all these different devices, I think a lot of people don't realize they're super easy to get a hold of. You can either usually get them at your local pharmacy or a drugstore, a big box type store, or even online realtors. And then if you ever have any questions about what type of locking device might actually be best for you, whether it's a locking medication bag or a box, you can always talk to your pharmacist and ask for them for advice. And then another thing, there's locking medication devices, but you can also have a safe storage location. So you may actually already have something in your home that would meet the needs of this. That could be anything from having a safe, having an existing cabinet or drawer that actually already locks. And if you don't have a cabinet that already locks, you can even sometimes order online different cabinet locks that can make your cabinets then become a safe storage location. So basically, there's lots of different options, and really, we just want to let everyone know, making sure that you use a safe storage medication device or location will really greatly reduce the risk of any opiate misuse in your home, or the chance that your medications in general might be stolen.
That's super helpful. Thank you. So that's a really good start, and those things are really good to know. So going to Endalkachew, what if I'm concerned with the amount of opioids that I have in my house? Or what if I'm prescribed opioids by my doctor and I either don't want to take all of them, or I'm not really comfortable starting to take any of them? What are some things I can do?
Well, thanks for phrasing that question, Melissa, and I'd love to tell you a little bit about this topic. This is one that is very near and dear to my heart, so I'll be more than happy to tell you about alternative pain management strategies, as well as how to limit opioids in your home. You know, before doing so, I really want to thank Jessica for centering why it's so important to safely store and dispose of unused or unwanted prescriptions. One of the biggest questions that I get from folks is, what are the simple things that I could do to ensure that my family and my friends are safe when it comes to prescription opioids? And my answer is that locking up opioids in your home and safely disposing them are two of the easiest ways to keep your friends and loved ones safe. And I want to make sure that I say that again, because these are very simple but rather effective strategies. So number one is locking up your medications in your home. And number two is safely disposing your medication. While those are simple strategies, it's also great to be aware of other ways you can mitigate the risk of opioid misuse in your home, as well as your greater community. Especially, you know, one of the stats that Jessica said that I really want to call back on is that 75% of opioid misuse starts with people using medication that was not initially prescribed for them. And those are either taken from families or friends. And a good approach in that case is to really think critically about the amount of prescription opioids that are in your house in the first place. So for those of you, you know, on this live wondering, how do I limit the quantity of opioids in my home? The first strategy that you want to approach is to be aware of, you know, the actual concept that you can ask for a partial fill when visiting your doctor. So if you need an opioid prescription for an injury or a surgery, you can ask your doctor or your pharmacist for a partial fill of your medication. In this case, it's very important because there's a lower likelihood that you'll have leftover medication. This is also a great strategy to limit just the overall opioids that are in your house at one time. Second is having a conversation with your doctor and seeing if they can prescribe you just a few days worth of prescription opioids before you transition to, you know, over-the-counter pain relievers such as ibuprofen. You know, many patients actually find that they only need a limited quantity of opioids after surgery. So this conversation with your doctor is really important. And the other one is to discuss with your doctor and explore alternative methods of pain management. Opioids aren't the only painkillers on the market, and they're not always the best way to fight pain. So in some cases, even, you know, the over-the-counter drugs can be equally as effective and rather have fewer side effects. I say that, you know, I rather say that with a caveat that you should always consult with your doctor about alternative pain management options to see if they're the right ones for you, because everybody's body is different. And so if you're wondering, you know, you're saying a lot about alternative pain management options, but what are those actually? So we're talking ibuprofen. We're talking about, you know, hot, compressed, or ice. We're talking about exercise therapy, physical therapy, stretching. We're also including other forms of therapy such as acupuncture, massage, and such as meditation have all proven to help relieve pain. So really in closing, if you take anything away from my portion of the presentation, I want it to be number one, that lock up your meds by, you know, purchasing a widely available, cheap, lockbox via your local retailer or Amazon, or you can also secure them for free at your local Community Prevention Wellness Initiative Coalition sites. So these are spread out all across Washington State, and there are 82. So some of those coalitions have free lock bags that you could just go in and ask, and they'll ask you to fill out a quick pre and post survey, and you can have access to those lock boxes. The second is safe dispose of medication by visiting your nearest pharmacy or drop-off site, which can be found on medproject.org. That's medproject.org. And if you don't want to visit the site, you can actually request a discrete unmarked mailback envelope, so you can return the unwanted and unused prescription right from your house. And number 3 and number 4 are to limit the number of opioids in your home by discussing partial fill, as well as exploring alternative pain management by connecting with your doctor. And number 5, and this is really, really the most important one, is to give yourself a pat on the back, because those simple steps, right, 1 through 4, with those simple steps, you're helping to keep your friends, your family, and just your overall community safe. So make sure you give yourself a pat on the back for even attending this call. This is very important. So we're glad that you're joining us today. Thank you, Melissa.
Thank you, Endalkachew. That is so important, and you are exactly right. Make sure that you are really thanking yourself for taking the time to attend this call. This is a big deal. So this is actually the part of our talk where you get to talk. This is the question and answer part. So go ahead and type your questions in the comments portion, and we will answer them. If we can't get to all the questions today, or if you don't feel comfortable typing in your question in the comments, you can email jessica.blose@hca.wa.gov. Her email is on the slide. So I have a quick question for Endalkachew, and that's, if I am prescribed an opioid and I decide I want to take it, how can I really make sure that nobody who visits my house or my kids or my nieces and nephews, how do I make sure that nobody else takes that opioid?
That's a great question, Melissa, because it already shows that you're thinking about safe storage, and I think that's a great first step. And so the first thing is to go back to what Jessica said, right? To make sure that you're not storing medication in unsafe areas, bathrooms, easily accessible locations, counters. But really the most important concepts are, if you're prescribed opioids and you want to make sure nobody else takes them, the use of locking bags, like I said, the locking device, or keeping them locked up in a safe are really fantastic strategies. And as I stated earlier, and I'll make sure to communicate this again, you can purchase those for minimal price, or you can access them for free at your local coalition. So there are, ways of securing these lock bag devices. So make sure you take advantage of those.
That's great. So where do I get these? Where do I get this said locking bag that you talk about?
Fantastic. Another great question. So to clarify further, you could buy them at your local hardware stores, right? You could buy locking bags at your local hardware stores, or you could get them on Amazon. You can get them at some pharmacies, and you can also get them at the coalitions that I mentioned earlier.
Cool. Okay, thanks. So then this question is for Jessica. So I have actually heard that you can totally dispose of your medications at home as long as you grind it up with a coffee grinder first, that's okay. Is that true?
Great question. This kind of falls more into like urban myths of drug disposal. So using things like coffee grounds, kitty litter, flushing things down toilets, throwing medication out in the trash. There's actually only one environmentally safe way to dispose of medication, and that would be through using a secure drug take-back location. Again, you can identify and find on that really great website, medproject.org.
Very good.
Or also the secure envelopes, which you can send medications back, that you can also request through the same website. And I think, a lot of us living in the Pacific Northwest, we love like the natural beauty, love, being good stewards of nature. And when you safely dispose of your medication, it actually helps to keep wildlife and groundwater free of contaminants, because there's also been lots of research where scientists here in the Northwest have been able to find evidence of medications that were disposed of incorrectly getting into both the soil and the groundwater, which again is really dangerous for wildlife and then for all of us with our drinking water. So it's something that's not really thought about a lot with prescription medication disposal. But in addition to keeping you and your loved ones safe and giving you peace of mind by using one of these safe disposal sites, you actually can also protect the environment.
Okay, that's good to know. Thank you. So just switching gears a little bit, you guys talked a lot today about making sure that you you send back your medication if you don't end up using it all, or that you safely dispose of it, and that you lock it up. So if my doctor is prescribing me medication, even if it is for opioids, shouldn't I just take that?
So I can try and answer this one. So in this scenario, it's really, really important to know that, like Endalkachew talked about earlier, you can always talk about with your doctor the chance of taking a non-opioid or non-prescription pain management medication or strategy post whatever has given you the prescription, whether you've just had surgery or you've broken an arm, anything that's going on. So there's lots of different ways to manage pain, some of which we talked about already. This can be over-the-counter painkillers, icing and resting different things. So you also have the ability to always ask for just a partial fill of your opioid prescription at a pharmacy. That's something that's new, that's allowed under Washington state law, because you may not necessarily need an entire course of treatment to help resolve your pain. Endalkachew had brought up a really good point earlier that I do want to highlight again. If you have any questions about alternative pain management strategies that are not opioid medications, you should always talk to your doctor or your pharmacist about this, and they can really help you make the best decision for yourself or for your loved one.
That's really helpful. So that brings me to another question, and this could be an Endalkachew question. So what if, let's say I had oral surgery a while ago and I have leftover medication? What do I do with that?
That is certainly an Endalkachew question, and I'd be happy to tackle that. So in the case you are trying to get rid of, unwanted medication, there are many, many avenues to do that. And these avenues are available to really make it easy for folks that want to dispose medication in a safe and environmental friendly manner. So one of the first ones is really to visit a pharmacy that is sort of a take back location by visiting medproject.org. I know we are saying this, I can at least count on one hand. I think it's been mentioned 5 times. So medproject.org, that's the 6th time now, to go and find a nearest pharmacy that is, accepting medications. The second one is there are options for free mail back envelopes. So again, by going on medproject.org, you can get an envelope. It will get delivered to you. You can go ahead and put your prescription medication in there, and you can go ahead and drop it at your local USPS in the blue box, and they'll take care of it. So the other thing is many of our CBWI sites are also hosting a national take back event, which takes place on April 24th. So this is a special day that is dedicated to safely disposing medication. And many, many families across the nation take part in that. So while you can dispose medication anytime you want, you have that one special day to really, model what safe medication use and safe disposal looks like to, your family members and to your friends, to really take them on that journey. Go ahead, take them to your local store and model what it looks like to safely dispose medication.
Yeah, that's super helpful. So, and I just for people that are watching this, and just to make sure kind of like what the goals are and how people are clear, Jessica, what would you say to somebody who didn't have any young kids in the house, and sort of felt like, how careful do I need to be? Like, do I really need to lock my meds up? Is it that big of a deal? My kids are older. I know they're not going to take my meds.
Definitely. So I know we've been talking a lot about families and kids, but you're absolutely right, Melissa. Not everybody lives with young kids, but this is still something that's important for everyone to consider, because especially as we're moving forward, hopefully with COVID-19, and we'll be able to spend more time with friends and family. We might not have kids, but we will have friends and family who will be coming into our homes again at some point. And again, making sure that your medications are securely stored so there's no risk of them being taken or misused by anyone at all who's coming into the home. This could even be people like contractors who might come into your home. Just locking up your medications is always a good, safe idea to ensure that they're not going to be at risk of being misused by anyone who might come into your home, not just kids.
That's awesome. Thank you. That's helpful. So then, Endalkachew, what if I want to get rid of my medications and I really don't want to go anywhere? What do I do?
Mailbacks. I got the answer.
Yeah.
That's what you do.
Okay.
If you're sitting at home and you're like, look, I'm not trying to drive over there.
I want to do it.
Right. The nearest dropout site. It's really they're based by zip code, so you should be able to find one that's closest to you. But you're like, you know what? I don't want to go on that drive. Mail back. They'll send you the mail.
Cool.
Put your disposable medication in there. Drop it off, and you're good to go.
Great.
Easy peasy.
Great. And then, is there any special things you can do to protect your privacy when you do mail medications back? My medication has my address and my phone number and all kinds of information about me. So how do I make sure that what do I do before I mail it?
That is a great question, Jessica. You think you can lend some insight on that?
Sure. I think one of the things that can be done is, you can always use something like a permanent marker to mark off your label. You can remove your label. But like Endalkachew said, this brand new feature in our state about drug mailback envelopes, super discreet. It's totally an unmarked envelope. Your medications go into this sealed thing. It gets sent securely through the United States Postal Service.
Okay.
And I have sent medications back myself through this process because, again, during the pandemic, didn't want to leave my home, trying to do social distancing.
Yeah.
And I was really bored trying to clean up a bunch of extra stuff, found some medications I had some of the same concerns, but there are safe, secure, and confidential ways to return your medication. And the envelope feature can be really, really helpful for helping you to get medication returned, again, in a way that's safe and secure.
Awesome. Well, thank you guys so much. I'm not seeing any questions from our audience in the chat, in the comment section. But that doesn't mean that you are done asking questions. You can reach out to Jessica Blose at the Healthcare Authority if you have additional questions. And if you did not get our repetitive messaging from this Facebook Live event, please go to medproject.org where you can get a bag sent to you to mail in your unwanted medication. It's a great thing. And if you want to learn more about keeping yourself safe and your loved ones safe, go to getthefaxrx.org. And if you want to watch this again or you want to share it, this will be recorded and available on Facebook as well. So with that, I'm not seeing anything in the comments, and I really do appreciate you taking the time to listen and watch this today, and we will talk soon. Have a great day, everybody. Thanks.